Welcome back guys. Now in this video let's discuss about lung volumes and capacities. Now what are these lung volumes and capacities? Guys, there are four important types of lung volumes like tidal volume, inspiratory reserve volume, expiratory reserve volume and residual volume. Now what exactly are these volumes? First let's begin with the tidal volume. Normal tidal volume value is 500 to 700 ml. Tidal volume value is 500 to 700 ml. So first of all, what is this tidal volume? Tidal volume is the amount of air that enters into the lung during inspiration, or you can also say tidal volume is the amount of air that exits out of the lung during expiration. So the amount of air which is entering into the lung and exiting the lung is called as the tidal volume. So with every breath 500 ml of air is going to enter into the lung, and with every expiration 500 ml of air is going to exit out of the lungs. So this is nothing but the tidal volume. So the amount of air which you take in and which you take out is called as the tidal volume. Simple. Now see, I am sitting like this at rest. The amount of air which I have entered into my lung with inspiration is the tidal volume. Okay, 500 ml have entered into my lungs, 500 to 750 ml. After this, let's talk about the inspiratory reserve volume. Okay, so what is this inspiratory reserve volume? Inspiratory reserve volume means there is a reserve for inspiration. What does I actually mean by say? You ask me to inspire. Now, I am actually taking the tidal volume. But if you ask me to take extra air in, yes, I can take it. Something like this. So, I can do extra inspiration. So, that is called as inspiratory reserve volume. So, I can take an extra of almost 3000 ml. Apart from tidal volume, I can take extra air. I have a capability to take an extra air. So, this extra air which have gone into my lungs is called as a inspiratory reserve volume. Okay. Now, please look at the definition of inspiratory reserve volume. Inspiratory reserve volume is the additional air that you can inhale or inspire above the tidal volume. Sir, when you are going to have this inspiratory reserve volume, for example, now you are passing by a dumpster. Okay, there is this one area, there is a dumpster which is present over here, and very bad smell is coming. So while you are passing through that area, you don't want to breathe. So even before entering into that area, you have taken deep inspiration. Means you have taken the tidal volume as well as you have taken the inspiratory reserve volume, and you are passing by the dumpster, while you are passing by the dumpster. So while you are passing by the dumpster, or when you are taking a deep dive, okay, so you are taking a dive into the water. Now while you are taking a dive into the water, you need to take deep inspiration, not just the tidal volume. You have to take the extra inspiration. So that extra air which I have entered into the lungs is called as the inspiratory reserve volume. Okay. Now after discussing about the inspiratory reserve volume, now let's talk about expiratory reserve volume. So what is this expiratory reserve volume? Expiratory reserve volume is somewhere around 1200 ml. Okay, 1200 ml. It's the extra air that you will expire out. Normally, if you ask me to expire, see. So tidal volume is going to come out first. But with effort, I can take extra air out of my lungs with effort. Something like this. I can take out some extra air out of my lungs. So this extra air that's coming out apart from tidal volume is called as expiratory reserve volume. Okay, I can blow out extra air. For example, when, sir, I am blowing the balloons. Okay, in a party I am blowing the balloons. So I am trying to get out, like I am trying to take out air out of my lungs with effort to blow the balloons, or even to blow the candles, or even to blow the trumpet. Okay, trumpet. Now let's see the definition of expiratory reserve volume. Expiratory reserve volume is the additional air, see, it's the additional air that you can exhale or expire beyond the tidal expiration. When, see, the extra air that you are using to blow out the candles. Okay, the extra air which you are using to blow out the candles on a birthday cake with only one breath. Okay, with one breath you are trying to, you are going to blow out all the candles on the cake, like, so the extra air you are taking out. So this is the expiratory reserve volume, 1200 ml. Now let's talk about the residual volume. So what exactly is this residual volume, sir? Residual volume, the value is somewhere around 1300 ml. Residual volume means whatever you do, whatever the effort you keep, you cannot take out certain amount of air out of your lung. All the time, certain amount of air is present inside the lungs. Whatever you do, you cannot take it out. So that volume, that 1300 or 1200 ml of air which is present inside the lungs is called as a residual volume. So look at the definition. Residual volume is the air that no matter how hard you bear down, how hard you try, it cannot be forced out, which helps in preventing the collapse of the alveoli. Okay, some amount of air is all the time present inside the alveoli. Okay, it is must and should, it should be there, otherwise alveoli will collapse. Okay, so this is residual volume. After discussing about the volumes, now let's discuss about the lung capacities. Static lung volumes are completed. Now let's discuss about the lung capacities. What are these capacities, sir? If you add 2 or more volumes, that will give you capacities. For example, how many capacities are there? Inspiratory capacity is there, which is a combo of tidal volume and inspiratory reserve volume. If you add inspiratory reserve volume and tidal volume, for example, say, now I am at rest, I am not inhaling or I am not exhaling. Right now you came to me and you ask me how much I can breathe. See, I can take the tidal volume in first, like this, and I can take inspiratory reserve volume also. So I can take both tidal volume plus inspiratory reserve volume. This is my inspiratory capacity, how much maximum I can inhale. Okay, so inspiratory capacity is tidal volume plus inspiratory reserve volume. Tidal volume is 500 ml and inspiratory reserve volume is somewhere around 3000 ml. So 3500 ml is the inspiratory capacity. Okay, now what is the definition of inspiratory capacity? Is all air that can be inhaled. Okay, it is calculated by adding together the tidal volume and inspiratory reserve volume. Now let's discuss about functional residual capacity. So what is functional residual capacity? It's a combo of residual volume and expiratory reserve volume. In a simple way, we can say something like this. See, what you can expire out. Okay, how much you can expire out. Now, 2500 ml. What is this functional residual capacity, sir? In a simple way, sir, see the amount of air that is present in your lungs after normal expiration. I should say something like this. See, the amount of air which is present in your lungs after normal expiration. Normal expiration is, see, you are removing the tidal volume. Okay, so tidal volume is going out of your lungs. So what is the remaining air which is present in your lungs at rest? What is the amount of air that is present in your lungs is the functional residual capacity. How much is present inside your lungs? Residual volume is there. Whatever you do, it's not going to come out. Residual volume is there. Plus expiratory reserve volume is also there, right? With a normal expiration. After a normal expiration, the amount of air that's present in inside your lungs is the functional residual capacity. After normal expiration, there is expiratory reserve volume as well as tidal volume. So look at the definition. Functional residual capacity is the air that is not expired after normal expiration. See, it is the sum of expiratory reserve volume and residual volume. Now after this, let's discuss about the vital capacity. So what is vital capacity? Vital capacity is the maximum amount of air that you can expire after deep inspiration. After taking a deep inspiration, how much air you can take out of the lungs? See, I am having a deep inspiration. After having a deep inspiration, I can take out inspiratory reserve volume. I can take out tidal volume. I can even take out expiratory reserve volume. So, IRV plus TV plus ERV, expiratory reserve volume. So, vital capacity is all the air that can be expired after maximal inspiration. After taking a maximum inspiration, what and all the air that you can take out of your lungs is the vital capacity, which includes inspiratory reserve volume, tidal volume and expiratory reserve volume, but not the residual volume. Whatever you do, you cannot take out the residual volume out of your lungs. Okay, so IRV plus TV plus ERV is the vital capacity. Okay, it is somewhere around 4700 ml, almost 4.7 liters of air you can take out of your lung after maximum inspiration. Now let's talk about the total lung capacity. Total lung capacity is the combination of all the volumes. Okay, so inspiratory reserve volume, tidal volume, expiratory reserve volume and residual volume. If you add all the volumes, it will give you total lung capacity, which is somewhere around 6 liters or 5900 ml. Okay, how much amount of air that you can take into your lungs? Okay, all volumes, combination of all volumes is the total lung capacity. Okay, so in this video we have discussed about the lung volumes and lung capacities. Now important points which I want you to know regarding your exams, with your exams in mind, is that, sir, which volumes and capacities cannot be measured with spirometry? There is a study called as spirometry, with which you can calculate the volumes and capacities. There are certain volumes which you cannot calculate, and there are certain capacities which you cannot calculate again. What are they, sir? See, residual volume, is it going to come out? It's not coming out. If it's not coming out, can you calculate it? No. So residual volume is not able to, you are not able to calculate it with spirometry. Now, functional residual capacity. So, functional residual capacity is a combination of, okay, it's a combination of expiratory reserve volume plus residual volume. You can estimate the expiratory reserve volume, you can know the expiratory reserve volume, but residual volume you cannot estimate. Why? Because it's not coming out. So, automatically, functional residual capacity is also not calculated with spirometry. And total lung capacity. Total lung capacity is a combination of all the volumes, including residual volume. If you cannot calculate residual volume, automatically total lung capacity cannot be estimated. So these three, residual volume, the one volume, and two capacities, functional residual capacity and total lung capacity, they cannot be measured with the spirometry. Okay, and next question that will come in your exam is, so then what are the methods to measure the functional residual capacity? Okay, now functional residual capacity is measured with the help of studies like body plethysmography, nitrogen washout technique, and helium dilution method. So helium dilution method, nitrogen washout, and body plethysmography are the techniques which are used to measure the functional residual capacity. Okay guys, in this video I have discussed all the capacities and volumes and also important points which are needed for your exam. Hope the video is helpful. See you in the next video. Thank you.